morning. Hi, welcome to DRT Behavioral Services. As promised to you, we are discussing sleep disturbance this morning. I'm here with all of my staff. I'm Dr. Delvena, one of the psychiatrists here at DRT. Meet the rest of the staff.
Hi, I'm Nisha. I'm a graduate student at FIU, and I'm the office manager here at DRT.
How you doing? My name is Sean Wright. I'm a graduate student as well with my bachelor's, and I handle the insurance.
Hi, I'm Amanda. I'm the front office coordinator.
My name is Tajay Dunbar. I'm one of the reps here that work in the office, and I'm also a student studying business management.
My name is Jamila Trumbull. I am the psychotherapist of the office, and I'm also a former athlete, and I specialize in sports wellness and mental wellness.
Hi, I'm Jacqueline Small. I'm the physician assistant at the office, and I'm also the coordinator of our wellness program.
So as you can see, we have a variety of experiences here. Tajay is actually one of our admin staff also. He is a student. We do want our staff to grow and become stronger in mental wellness and brain love. That's our motto, right? Yay, brain love! And Tajay also helps with our music therapy program that we will be starting soon. I wanted you to meet everyone because this is part one of our video series, which will be Facebook Live, and we'll replay these things, and we'll also have a video on our website for you, which is brainlove.help. Well, why are we here today discussing sleep disturbance? I think this is an issue that affects a lot of people, and the folks in the room with me, they agree as well. Raise your hand if you've ever had any type of sleep disturbance. What do we mean by sleep disturbances?
Not being able to sleep through the night.
Yep. So, and because I want to ensure everyone can hear what we're saying that's important, everyone project your voice so that way we can be heard well on Facebook because we want our listeners to hear us. So, Nisha said,
Not being able to sleep through the night.
Not being able to sleep through the night. So, not sleeping through the night, but also not being able to fall asleep at night or waking up a lot during the night. We know that there are some common causes of sleep disturbance, which sleep disturbance affects a lot of people regardless of your age, your gender, your socioeconomic status. People who have a lot of money or feel that they're well off, they have sleep problems as well. What can we mention that are some common problems of sleep disturbance? Not being able to fall asleep, not being able to sleep through the night, or waking up early in the morning. What are some causes of that?
Well, some causes of that is different types of medications that people may be on, as far as like steroids, okay, that can prevent you from falling asleep and also can prevent you from staying asleep to get a good 7 to 8 hours of sleep.
That's a good point, PA Small, because a lot of people take medications every day. Some of the common causes or some of the common ailments that people have to endure, physical ailments, high blood pressure or hypertension, diabetes or high sugar, complications from being overweight or morbidly obese, such as sleep apnea. And so these are common issues, as well as some breathing problems like COPD or asthma. And that these are common issues. People are commonly prescribed medications for these things. So we already said steroids, but also blood pressure medications like water pills, known as diuretics, beta blockers, which help people with blood pressure like metoprolol and some other things, atenolol. Also decongestants. We use that a lot here in Florida because of allergies and things like that. What are some other common causes? Let's say someone is not on medication at all. What causes you guys to not sleep or not be able to fall asleep at night?
If you're stressed.
If you're stressed, absolutely. So stress, one of the more common reasons not to fall asleep at night. So, things like financial issues, maybe a lot of studying, maybe feeling overburdened, relationship problems. What are some other common causes?
What?
Yeah, we all know. Let's speak at once.
I was gonna say like eating heavy meals or not having an appropriate routine at night. A lot of people do a lot of activities out of their bed, such as watching TV or reading books. So some of those things aren't.
Absolutely. And that's great because here at DRT, we believe in balancing well as best as you can. I wanted to say perfectly, but it's difficult to be perfect in life, but we believe in balance. So balance means good nutrition. That's what our psychotherapist mentioned. You got to get well-balanced meals throughout the day. Also, not doing certain things which will be counterproductive towards being able to fall asleep. Other common reasons, and this is why we're here: depression, which, sadness, anxiety, nervousness. So stress, depression, anxiety, those are common reasons why people don't fall asleep at night or can't sleep through the night. We have to remember our day creates our night, right? Whatever we're doing through the day, that creates our night.
And that's I'm sorry, go ahead. I'm sorry. I just wanted to say that's a great point, Dr. Thomas, my mom. Just wanted to also say that during the day, it's good to get enough routine, and you can't be sleeping before 3 o'clock. You know what I'm saying? It's best to sleep before 3. Don't sleep after 3. If you're gonna sleep at 5, 6 o'clock, it's gonna mess up your sleep routine during the night. So if you're gonna take a nap, make sure it's under an hour, 30 minutes, 45 minutes before class, something like that.
Wow, that's great, and it's loaded with good information, because you actually made 2 or 3 great points there, right? Jamila, what did you hear about that?
The times that you are supposed to sleep should be before actual bedtimes. So if you go to sleep or have a nap time after 5, it's going to interfere with your sleeping regimen at night. Also, you mentioned a routine, developing a routine throughout the day, meaning something that you're constantly doing that kind of gets you within a balance or a schedule where you are focused on what's happening and developing your day.
Yeah, exactly.
Was that it?
Yes.
So, and he's a student, she's a student, he's a student, she's a student. And so, she actually works a couple of jobs. So you're here, and then you also have your own business on the side. And so it's important when you're balancing a lot of things that you have to create a routine. And so students, it's very common that you guys have these schedules which are kind of erratic, right? And we've all been there. We've all been students. You're studying late. Sometimes you want to sleep in the morning and get out of bed at 2 o'clock. But you really can't do that. You have to have the same routine every day. You have to get up around the same time every morning. You should go to bed, if you can, around the same time each night. Of course, on the weekend for younger folks, that doesn't include me or you anymore.
Wait a minute.
You're not that
Yeah, right.
The one
But yeah, I would say like these folks here, they want to do things on the weekend and stay up all night long. And I used to do that, but I can't afford to do it anymore. My body won't respond.
Well, speaking on behalf of the older generation, okay,
Well seasoned.
also with the sleep disturbance, Dr. Thomas, I have a lot of especially females that's going through menopause. When they get to that point, because of the lack of estrogen and is lowered, they don't have the ability to really sleep as they used to. So that's like a big problem, and a lot of them say, I don't understand the reason why. Well, when you're coming up on that 4th or the 5th decade of life, you begin to not sleep late at night. Some of them only get about 2 or 3 hours of sleep, and then you're waking up. So with a hormone imbalance and a hormone change, that can also interfere with your sleep rhythm.
Excellent points.
I have a question. Because my mom is going through that, what are things that she can do to help that?
Well, with different things, like with any other issue that a person may have that have the hormone imbalance, there's different medications. Sometimes you'll go to your doctor and make sure that, first of all, you are in the menopausal stage, okay? And then they can also do hormone replacement with that, and that just depends on what is good for that individual person. They can also too increase your exercise. As you lose estrogen, you may have to do more things than you did before, like increase your exercise, be able to go to bed a little bit earlier, okay, and then also to make sure you get up at the same time each morning. So your routine gonna have to be a lot better than it was before. Remember, the old thing that people used to say is that, well, when I was younger, I used to can do this. Well, you can't do that anymore. So you have to add more to your exercise. You have to have a better type of balance of your meals. You also have to have a better routine when you get older.
Great commentary. It is important to have other doctors or providers involved in your care. Every woman should have an OB-GYN or gynecologist. I said OB, but once you get past that a certain age, you don't need an obstetrician, but a gynecologist in order to do those things. You definitely have to be diagnosed with being in menopause or premenopausal type stages. So that's great commentary. That's a common issue that we see also. People going through different stages in life, changes in their hormones. Remember, the brain is the most important part of our body. We have a lot of essential organs, but we always forget about the brain. And that's why we always mention brain love, because your brain controls a lot of things. All of these hormones that we secrete, those things are initiated up here in our brain. Then it tells the rest of the body what to do. So it comes from up top. We have a lot of information to share, a wealth of information. We want to go into a discussion more about the causes. What can you do for certain types of sleep disorders? And we want you to understand this. The objective here is to teach everyone that it's not up to a pill, okay? We're not a pill mill here. We do everything here. PA Small mentioned that she is in charge of our wellness clinic. And so we will definitely share with you some of the things that PA Small will do for you in order to help with that. Our psychotherapist is here to provide different interventions in order to deal with depression, with stress, with anxiety, and she too can talk more about what's available for that. And of course, I'm here to help with some psychotherapy, and also if medication is medically necessary, we can do that. But besides medication, the psychotherapy, the wellness, which is the massages and things like that, there are things that people can do on their own that the psychotherapist, Mr. Jamila mentioned, and also Tajay mentioned, and some of you guys mentioned. Good balance, exercise, having a routine, nutritional eating, those sorts of things, and watching also the types of medications you're taking. Mm-hmm. What other things do you guys want to add on to that? This is part 1 of our discussion, like I said. We have part 2 coming, we have part 3. You're going to hear from us a lot more because I have such a fabulous staff here. Everyone has such great experiences and so much information to share. You can't get everything from one person.
I have a question. What do you guys think about snoring, and when is it like not natural? When it's overboard, when somebody over snores, or when it's, yeah, that's basically what I'm saying.
Sean, I like that question.
And coming from Sean.
Yeah. So, Sean asked about snoring. Does anyone here snore?
I snore.
Oh no. Misha.
But that's only when I'm extremely tired.
Yeah, like when I'm really tired, I snore.
Well, that's all.
Do you snore loudly or like, is it a quiet snore?
We're planning. We're pre-planning, so we're trying to figure this out.
So, guys, there's like an inside joke here. We're going on a morale trip at the end of the month. And so, you got to have roommates on this trip. And Amanda, Miss Spring, just admitted that she snores.
So,
do you snore loudly or like softly?
No, softly. I don't snore like that.
So it's gonna be a roommate.
Oh,
don't say. Anyone else snore?
Well, like I say, when I was told, because I have never known myself, because I'm asleep, of course. That when I'm extremely,
that's not true. Sometimes you can
do
tell
know.
when you're snoring. I haven't done it
Because you wake yourself up.
well, okay, I haven't gotten to that point yet. But when I'm extremely tired, and so I was always trying to figure out, like, why do I snore when I'm extremely tired, opposed to when I'm just not, that tired. So
yeah.
Yeah.
And so it has something to do with relaxation. Mm-hmm. Snoring is caused by the structures in the back of your throat, right? So that noise that you hear when someone snores, it's because of the anatomy. And so what do I mean by that? If you have structures in the back of your throat that come together and they close, and you're trying to breathe, when you're trying to push that air out through those closed structures, you make that noise that sounds like snoring. And so there are certain things that can increase the risk of your structures coming together and sort of closing while you're trying to sleep and push air. And what you mentioned, relaxation, I'll add on to that. When people consume alcohol and if they're, extremely inebriated, you might notice that they snore more or snore very loudly, and that's because relaxation of those structures has taken place. And even when we're tired and just kind of worn out and exhausted, that can occur. Admittedly, I snore when I'm very relaxed and tired. And do I snore?
Almost every night.
Those two.
Almost every night? I don't snore every night.
He's telling you, this is proof.
You want me to snore.
Maybe this is a sidebar conversation.
No, but I've actually noticed that if you exercise more, that it decreases the rate of snoring. That's true, right? Because I noticed it on myself.
Yeah.
And exercising can also help with those healthy thoughts that you need to create for yourself.
Yeah.
Helps with sleeping later at night. It creates tension in the muscles, makes you relaxed. And that goes with that snoring she was talking about.
Right.
Working out is very vital for the human body. Not only the body, but the mind and the spirit itself.
Yeah. And you know what? I think that's a segue to the.
Cut that out.
No, those are good points. We are impressed, aren't we?
Yeah. From our recent college graduate.
And also Nisha.
Yes,
Zoom in on Nisha.
Tajay, a lot of people will want to know, like, well, how many times a week should a person work out? In order to.
I say
That's maybe the next video.
I'd say it depends on the person. A person like myself who played sports growing up, I kind of know what to do. So I try to work out about 4 to 5 times a week. Not saying that I do it, but it's regular for me.
Not that I do it.
Somebody else who may be new to this, somebody that's never worked out, in their life, about 1 to 2 times a week, but they should be doing different exercises at home, like, anything that keep the body, hydrated, anything, drinking a lot of water, fruits, stuff like that, because that's also healthy for the mind.
What's the official recommendation?
3 days a week.
3 days a week, at least 20 minutes of strenuous activity. So it could be cardio, like on a bike, on the treadmill, outside running, could be walking at a fast pace, could be lifting weights. But if you're going to lift as your 20 minutes of activity, you probably need to lift weights longer, because if you're not lifting properly, you're not getting that cardio that you need to count for that 20 minutes. So if you want to use lifting weights as your 20-minute exercise, you have to have less rest time in between your sets. So a lot of people don't know how to make lifting weights a cardio type activity. But in the interest of time, we do have to close this dialogue because we have patients coming in. Our office reopens at 10:30. This is a good segue to say this. Remember, what you do during the day creates your night. In order to sleep, you have to give your brain a reason why. You have to give it some sort of trigger, and that means you have to exhaust yourself throughout the day. Your brain is not just going to say at 9 or 10 o'clock, ooh, it's time for sleep, and go to sleep through the night.
That's right.
Yeah, well, it's true. You have to exhaust yourself. You have to really do all those things throughout the day to make yourself tired. Even homework and studying and reading, those things use ATP or energy also, just like physical activity, and actually much more. So if you have disabilities or if you're physically incapable of doing a lot of strenuous activity or exercise, read crossword puzzles, use your brain to think, and you'll be just as tired as the next person. So anyone want to add anything else at the end here? If not, we'll save some stuff for part 2.
Stay tuned in for part 2.